A very important point is patients need to understand what medication is for what problem. In my previous career, I used to be a respiratory therapist, and I've dealt with, unfortunately, some terrible situations in the emergency room where patients were admitted and unfortunately didn't survive because they chose the wrong inhaler to use. I've had many patients use the wrong device and empty an inhaler, and they were using the wrong drug the whole time. So I think what's very, very important, it's absolutely key for pharmacists to do this, is help the patient identify what the rescue inhaler is. Mark it, there's stickers, there's all different ways that you can mark that inhaler for them, and when they're short of breath. Also for asthma patients, make sure they have an asthma control plan, to make sure to work with the physician to come up with an asthma control plan, so when a patient is in trouble, they know what to do, what medication to take, and how much to take it. And also in regards to their refills. Unfortunately, a lot of patients will take their inhalers, they'll take it on a travel, on a train, and a plane, and unfortunately they may almost be out, and they don't think about it. And when they're out of the country, they run out of their medication, which could be an absolute disaster sometimes. So it's important that patients understand the difference between acute inhalers, what are used for maintenance therapy, rescue inhalers, what they're needed for and marked specifically, and if they're going on travel, to make sure all their prescriptions are up to date before they leave. And most important, make sure they take their medication before they ever get on a plane. You don't want to take it for the first time on an airplane and have an adverse effect where they have to make an emergency landing. So you don't want anything like that to happen.